Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Bharat N. He has done MD Pediatrics and after that he had done Neonatology Fellowship. And now he's working in Chinmaya Mission Hospital and he's serving the neonatal, that is the newborn babies. But however, he is a very kind person who has a compassion and concern for the overall health of the children. And as a result, he is going to talk about the commonest disease among the children, especially those who are there in the hostels, and that is the scabies. The scabies, people were thinking that low income people who are very poor they get, but today it is seen all over because whenever they're in the hostel or they have a contact with the infected person, they are also getting. So welcome, Dr. Bharat. So please tell us, it is said that almost more than 4 lakh children are having scabies. Does it affect only the children or adult also can get it? And what exactly is this scabies and how it comes?
Thank you, madam. Thanks for the introduction. Yes, scabies affects both adults as well as children. In children, it is predominantly seen in infants and less than 5-year-old kids because they are the most vulnerable. Also, it gets affected in babies or children who stay in hostels as well as boarding schools because there is overcrowding. And those children who are malnourished, those who are malnourished, they are also prone to develop scabies early. So this is a predisposing factor for kids to develop scabies. And this scabies is caused by one of the arthropod infestation. This is an arthropod infestation. This is not infection. This is infestation.
Yes,
Wherein,
infection is it goes into the blood and stream and
yes,
spreads all over the body. This is only
yes,
on the skin. Okay.
yes, it lies only on the skin.
Hmm.
We call it as Sarcoptes scabi var hominis. So this is the arthropod which lies on the skin. A female arthropod which is impregnated by male. After that, it forms the burrow. Means to say, it's superficial layer of the skin where a burrow is formed and it goes inside that burrow at a speed of just 5 mm per day. At a speed of just 5 mm per day. Once it goes inside the burrow, it starts laying eggs. It starts laying eggs. So this leg will take around 2 to 3 days for hatching. And this, after hatching, once the larva is out, it will take around 4 to 5 days to become an adult. And once again, the life cycle continues. So
Okay.
this is the life cycle of scabies arthropod. So the infection will become severe as the cycle passes.
So
And it
totally
usually
5 to 7 days. Once it comes on the touch with the skin, it takes about 7 days for the whole cycle to finish. Okay.
it becomes adult, and for 2 weeks it continues laying eggs as much as
Okay.
as much as thousand.
Thousands of them. Okay. Okay.
Yes, yes, as much as thousands, and around out of which many will hatch, many won't, like that. And usually the sites where it will go will usually be web spaces of the
Yeah, in
hand,
between the fingers and
in
yeah,
between the
toes.
fingers,
Yeah.
in between the legs, in between
Okay.
the leg fingers,
Hmm.
moist area like axilla,
Hmm.
and groin area where we
Ah.
usually wear our underwear. And in females under the breast, these are the moist areas where they go and they start laying eggs. And when they move, they usually secrete some substances which will cause the itching, which will cause
Okay.
itching. And also the other common lesions which we see in scabies is either we see burrow, especially in the web spaces, or we see pimple-like lesions, just acne, pimple-like lesions, where there is a movement of this ball.
Okay.
So during the course, it might sometimes go like a curve, or it might go a wavy fashion. Along the course, what happens? There will be small dots which will
Okay.
appear. So
Okay.
this is how we usually tend to identify scabies, and this is how it presents. In some kids, it will become so extensive that the whole body will be crusted like. We call it
Okay.
as crusted or Norwegian scabies, which is a
Okay.
severe
Okay.
form of scabies seen in very much immunocompromised or malnourished children.
Okay. How do
Yeah.
you identify that this is scabies only? Because
Yes.
itching can occur in allergy
Yes.
also and other
Yes.
conditions. So how do you say
Yes.
it is scabies?
Yes. It is with the circumstances also, and also with the examination.
Hmm.
Not every time we keep doing scrapings,
Hmm.
and the ideal way to demonstrate is you scrape and send for examination where that
Hmm.
very
Under the
tiny arthropod
microscope, they can detect.
detected under the
Yes.
microscope.
Hmm.
We usually don't do it in the clinical practice. Rather, we depend on the circumstances where
Hmm.
the baby is coming from. They are
Hmm.
coming with family, and the whole family is having similar symptoms,
Hmm.
and the symptom is more during night, and
Hmm.
it is a itching, which is a predominant symptom,
Hmm.
especially in the places
Hmm.
where there is,
In between the
especially in the web
fingers,
spaces,
yeah. Okay.
web
Web
spaces,
spaces.
and also there are this typical burrows
Hmm.
and nodules which are in the path of, like, which
Where
are
it is
seen
moving.
in the
Yes.
course of this
Hmm.
movement of arthropod.
Hmm.
So with this circumstances,
Hmm.
like, is there a overcrowding? Is there malnourishment?
Hmm.
Is the baby coming? Is the child coming from hostel? So
Hmm.
with the circumstances, we examine and we diagnose scabies. So
Okay.
need not
Is it
necessarily
because of the unhealthy, unhygienic condition, or it has got
need
nothing to do with that?
uh,
Yeah.
say that it has nothing to do with cleanliness. But yes, if you are clean, it doesn't mean that you will not get scabies. So
Okay.
scabies spreads through contact.
Hmm.
So if there is contact, scabies can still spread,
Hmm.
even if you if you bathe
Take a
daily,
bath. Okay. Okay.
because soap, soap which we use is not a scabicidal. Means to say it will not
Okay.
kill the
Okay.
scabies,
Okay. So
but
with the
or
regular,
like
I
such a
mean,
arthropod,
washing
it
the
will not
soap,
kill
it
them.
doesn't. Okay. Okay. And moreover, when we
It
wash,
doesn't. It
we
doesn't
just
help
brush, I
much.
mean, wash like this. We don't clean in between the fingers, no? Yes.
Yes, and we don't. It doesn't have a sufficient contact period.
Hmm.
So, yes, as reminded, madam, when we usually treat this in a different form, the scabies, we usually tell you have to treat yourself or the patient and also the family or those who are infected, those who are very laying very closely with that kid, and
So
also
that
its
means in the
environment.
hostel, all the roommates
Treating
will have to be treated. Hmm.
blanket therapy, treat
Hmm.
everyone.
Hmm.
So treat everyone.
Hmm.
Environment treatment, you you put the clothes of
Hmm.
the baby, like clothes, bedding, or the toys sometimes, or
Hmm.
even the bed sheet. You have to
Hmm.
dip it in water, warm
Hmm.
water, and then dry.
In the
And
sunlight.
treating,
Hmm. Hmm.
yeah, treating the kid as well as family is important,
Hmm.
wherein we particularly use permethrin cream.
Hmm.
So the application will usually be twice.
Hmm.
So the first application, if at all, if I'm giving now, the second
Hmm.
application will be 1 week later. And a
Okay.
specific instruction for application will be to
Hmm.
apply below the neck for
Hmm.
all kids above 2 years.
Hmm.
And apart from face,
Hmm.
every part of body has to be applied for
Hmm.
babies less than
Hmm.
2 years,
Hmm.
including
Hmm.
specifically
Hmm.
including web spaces, and
Hmm.
also say for example buttocks crack,
Hmm.
even that has to be included.
Hmm.
And once you apply, you have to leave 8 to 12 hours of contact period before you
So
wash.
that means
Means,
after meals or having milk, put it at night so that the whole
yes,
night it stays.
at
Okay.
around 10 o'clock you apply, morning
Hmm.
6 o'clock, baby should
Hmm.
bathe or the person should bathe, and that has to be repeated 1 week later. That's how the
Okay.
treatment of permethrin
Okay.
goes.
Okay.
Sorry, I mean scabies
And
goes.
what about the itching?
Yeah, itching we treat with antihistaminic,
Hmm.
cetirizine or chlorpheniramine. We usually give it for 1 to 2 weeks or
Hmm.
sometimes beyond,
Hmm.
because
Hmm.
sometimes what happens, the
Hmm.
bug dies, but
Hmm.
the itching continues beyond.
Hmm.
Unless and until there are new lesions, we don't
Hmm.
treat it again. So we
Okay.
just continue the antihistaminics for another 1 week.
Okay. Now, how to prevent it?
Uh,
Because the children are in the hostel and people with the
yes.
infection will be there. How to prevent it?
Treatment is the best way to, and you have to exclude it. Say for
Hmm.
there will be common questions from parent. Should I
Hmm.
stop sending child to school then? That will be the common complaint, common question that the parents ask. So no, you
Hmm.
should not stop sending. Rather, once you apply, 24 hours later, child can resume school, because adult
Okay.
burn will be like will die with that
Okay. The
treatment.
Saturday night they can apply, the Sunday they clean it, and Monday the child can go to school.
Child can go to school,
Okay.
definitely go to
Okay.
school.
Hmm.
And should I use like if you see there will be many people who will say that I can get rid of all bugs from your home. Like that, people will say, especially with the many advertisements coming up, those things are not needed. Rather, you can do on your own. Clean your clothes, dip it in the warm cloth, the warm water, and dry it thoroughly.
In the sunlight.
That will prevent the further infections.
Okay, okay.
Yeah.
And also, as far as possible, don't shake hands, When you shake hands during Corona time, I used to tell, when you do the shake hand, your Corona goes to them and their colleague comes to you. You are exchanging the Corona, but now you are exchanging the scabies also. So best to do namaskar and
No.
keep away from the infection. That's a good idea. Okay. So
Okay.
thank you very much, Dr. Bharat. You
Thank you,
have
ma'am.
explained so well the cycle of the
Yes.
scabies and also how to prevent and how to treat it. And thank you very much.
Thank you. Thank you, ma'am.